It's okay. Hey, it's fine. All right. You're worried. And that's why you're here. That's why I want to help. Okay? We have all the time you need so that you can leave today at least feeling confident that you'll be okay. All right? So, start again. Take your time. Okay. And when roughly did that start, would you say? Okay. What do you think brought it about? Anxiety. Okay. Well, our body has a lot of different ways to tell us that it needs something, something is wrong, or it's suffering. The best thing we can do is listen. Yeah? So if your body's telling you that your hand's on fire, you should put it out. And if your body's telling you that you're a bit worried, or something's not quite right, come and talk to us. Okay? It'll be okay. Right. Let's take a look. So the most important thing that you need to do right now is to relax. I always treat appointments a little bit like Schrodinger's cat. So, while you're in here, you're neither well nor sick. It might not sound particularly comforting, but thinking that way means that you're not sick. Okay? And there's nothing to worry about. So, if it's alright with you, I'd just like to place my hands on your face and just check your lymph nodes, your cranial nerve response, and things like that. Is that okay? It won't hurt a bit, and if you feel any discomfort at all, just tell me and we'll stop. Okay? Good. So, let's have a go. How does that feel? Okay, so I'm sensing a bit, feeling a bit tenderness around the face. Not to worry about. I'm just going to check it down. Okay. There's a little bit of inflammation around that area, and as you probably know, swelling of your glands can indicate that your body is fighting off an infection or something like that. Okay? Oh, sorry. Are you okay? Okay, just very quickly. Can you just, yep, that's it. So look at this. It's very bright. It's very bright. Okay, just follow it for me. Don't move your head. Just keep your head still. Perfect. Okay. Now I'm gonna just take a quick look in your eye. So I'm gonna get up close with the light. Okay. Look up if you can. Look down. Okay. Can you hear that? Okay. Okay. It's caught on my lanyard. How'd that happen? Okay. So I'm going to ask you to breathe in. So just breathe in and breathe out with me. Just checking your lungs. Okay, breathe in. Hold. Breathe out. Breathe in. Hold. And breathe out. Breathe in. Hold. Breathe out. That wasn't so bad, was it? Now I'm going to do the same on your back. Okay. Breathe in. Hold. And breathe out. Breathe in. Hold. And breathe out. One more time. Breathe in. Hold. And breathe out. Okay, that's fine. Right, just humour me for a moment. You saw me twitching my nose like that. I can't do it very well. Can you do it better? Okay. Go like that. Just going to take a quick look in your ears. Okay. Start with your left ear. Let's take a look. Okay. 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 The other ear. Look in. Ear. Okay. Alright. How do you feel? Can you do me another favour? If that's okay. Can you just sniff? I know it's not a very nice sound or nice thing to do, but that's it. And can you cough for me? Cough again. I'm just going to touch your throat. Don't worry. Cough again. Now breathe in through your mouth and out through your nose. I've got a bit of a cold. Was that difficult at all for you? Okay. I'm just going to take a quick look up your schnoz, if that's all right. Just lift your head. Okay. Okay. Allergies. You a smoker? No, it's okay. Drink? Water doesn't go. Okay. Well, I'm the registrar today, so what I think we'll do, if it's okay with you, is refer you to Dr. Shuga. You can see her right away. Just checked her schedule. It's absolutely fine. She's very good. You'll be in very capable hands. And she's actually our ENT specialist. So she'll probably do some of the tests that I've already done, but she'll go a little bit more in depth. And she'll be checking your ears, your nose, and your throat, because it's all connected, as you probably know. As far as I can tell, there's nothing seriously wrong. There's no major inflammation apart from your glands, no cellulitis or anything like that. But just to be sure, I want Dr. Shuga to have a look to make sure that we send you out of here right as rain. Okay. Nothing to worry about. I'll just let Dr. Shuga know you're on your way and go from there. Okay, lovely to see you. Thank you. Dr. Shuga, your next patient's here. Thank you.
Hello, I'm Dr. Shuga and welcome. I'm guessing Jim sent you over, correct? Great. Now can I have your name and date of birth for confirmation? Okay. Alright, that's very good. Everything is here. So now for your ENT examination, I am going to be carrying out various tests to ensure that your ears, nose, and throat are all in proper working condition. Would that be okay with you? Great. Well, I'm going to get started with your ears, and I am just going to get my gloves here. So what I'm going to be doing is I'm just going to start with an external look, just to make sure that externally your ears are looking very good. And I'll be starting with your right pinner, if that's okay. Alright. So everything is looking good here. There's no preauricular pits, no endural scars. And looking at the back, there is no post-auricular scars, no cochlear implants, no mastoid defoid. So everything is looking very good. And I'm just going to take my torch to look inside at your external ear canal, okay? Good. Alright, I'm seeing no osteomass. Your skin looks normal, no infection of any kind. And you have very clean ears, so that's nice. And I'll do the same for your left ear. Okay, still no preauricular pits, no endural scars, no post-auricular scars, no cochlear implants or mastoid defoid. So everything looks good externally for your right ear. And going back again with my light. And there's no osteomass, no skin infection, and you have a clean ear canal. So that's very good. Okay, so I'm going to be moving on to the next test, and what I'm going to do is I'm going to be testing for your hearing quality, and by that I mean I'm going to be checking to see if you can identify or differentiate between the different textures of sound, being hard, soft, and medium. Would that be okay? Great. Now I'm just going to give you a few examples. This is what soft sounds like. Got it? Good. This is what medium sounds like. Got it? Good. And this is what hard sounds like. Got it? Good. So I'm going to get started now, okay? And I won't show you the objects or triggers. I just want you to listen and tell me if it's soft, hard, or medium, okay? Alright, now this is the first trigger. Is this soft, hard, or medium? Very good. And the next trigger. Is this soft, hard, or medium? Very good. And the next one. Is this soft, hard, or medium? Very good. And the next one. Is this soft, hard, or medium? Good. And then the next. Is this soft, hard, or medium? That's wonderful. Yeah. You got all of them right. Alright, well, I'll be moving on to the next test, and that'll be for your nose test. We're done with the ears. Yeah, very simple, right? Good. Well, for the nose, I would just briefly examine the external part of it, just to make sure that there is nothing to worry about, okay? Okay. Now, have you had any difficulty in breathing recently? Okay. What about difficulty in identifying smell? Okay. Well, everything looks good externally. Your dosum is straight. The upper, middle, and lower thirds are normal, with normal width and normal attributes, so there is nothing to worry about. Okay, well, I'm gonna get back my gloves on, and we are gonna do some very easy tests. And what I want you to do for me right now is to take in deep breaths and let it out, okay? So breathe in, out, in, out. And I'm just going to hold down your right nostrils, okay? Then breathe in again, out, and switch into your left. Breathe in again, out, and one more time the right. Breathe in again, out. Okay, there is no more flow of air through both air canals or nostrils, so that's very good. Okay, now I need you to take quick sniffings for me, and then you breathe out, okay? Just something like this. Okay, all right. Breathe in, out. I'm going to hold down your right nostrils again. Breathe in, out, and switch into the right. The left, sorry. Breathe in, out, very good. There is no obvious case of nasal valving, so everything looks good there. And I'm going to carry out the last test for this breathing exercise, and I need you to just breathe in one more time for me. Breathe in, out. I'm going to hold down your right nostrils. Breathe in, out, and then your left nostrils. Breathe in, out. Which nose was it easier to breathe with? Yes, which of your nostrils? Okay. I'm just going to take my light and have a quick look inside your nose, yeah, just to make sure the internal part of it is okay. Alright? Alright. Okay, well, everything is looking very normal and good here. The nasal vestibule is not inflamed. The nasal valving is not narrowed. And your nasal septum is straight. Okay, moving on to the left nostril. And we see that it's the same here too. Nasal vestibule not inflamed. The internal nasal valve not narrowed. And you have a straight nasal septum. So that's very good. Okay, now I'm going to carry out the last test for your nose, and that was just a smelling test. I have 3 jars with me, and I just want you to let me know if you can perceive them. And if you can, just tell me what it is, okay? Alright. Ginger, very good. And the next one. Peppermint, very good. And now I want you to close down your right nostrils, okay, for this one. Good. Cinnamon, very good. And I'm just gonna bring one more jar, and you just have to close down your left nostrils this time around, okay? Ginger, very good. That is very, very good. Everything looks very good with your nose. There is nothing to worry about. You passed all the tests, and so far everything is looking very, very good. So I am going to move on to the throat, and I'm going to be starting with your mouth. So just having a quick look at your lips, and everything looks very good here too. There is no droopy lips, no swollen lips, so that is wonderful. Have you noticed any maybe pain or, I don't know, swollenness like for the past few days? Like it swells and it goes back down, or anything different at all with your lips? No? Okay, that's very good. Now, if it's possible, can you open your mouth as wide as you can? Just, yeah. That's very good. There's no sign of a trismus. And can you bring out your tongue and move it left and right? Just like that. Okay. There is no obstruction of tongue movement. That is very good. Alright, now I would need you to just open your mouth and say ah. And I'm just going to take my tongue depressor and just press down your tongue just to have a good look at your, the internal mouth. Okay. Well, everything is looking fine here. The buccal mucosa is not inflamed. Can you lift your tongue to touch the roof of your mouth? Okay. The flow of the mouth looks good too, the inflammations. And you can relax your tongue now. Can you say ah for me? Gonna bring back this. And at the back of your throat, everything is looking good. The oropharynx looks normal. Your soft palate and hard palate looks good as well. That's wonderful. Okay, and last but not the least, we'll be examining your neck externally, and I'm just gonna have a quick look and see if there's anything to be worried about externally. Okay, well, there's no signs of deformities, no signs of masses or scars, so that looks good. And if it's okay with you, I am just gonna feel around your neck. I am going to be checking for your parotid to make sure it's not enlarged and that there is nothing to worry about. Okay? Alright. Okay, your parotid looks good. It is not enlarged. And now I'm just going to touch for your lymph nodes. And your lymph nodes look good with no enlargement or inflammation. And now I'm going to move on to your thyroid, checking for your thyroid lobe. And there is no inflammation here. So everything was looking good. Have you felt any pain while swallowing, or any pain recently on your neck, externally and internally? No? Alright then. Well, that is the end of your ENT examination. I am so glad that you were able to come in. And for the result, you can come get it back next week. I just have to go through this just to make sure I didn't miss anything. But so far, everything looks very good for your ears, your nose, and your throat. Yes, everything looks looking perfect. Okay. Well, thank you again so much for coming in. Yes, do have a lovely day. Alright. Well, bye now.